Morgan. I'll be your student nurse today. How are you doing this morning?
I'm good. How are you?
I'm good, thank you. I'm gonna pull the privacy curtain and wash my hands. Can you give me your name and date of birth, please?
It's Alex Farwick and 6/12/2000.
Perfect. And before we get started, do you have any allergies?
Nope.
Alright, so today I'm going to be doing a head-to-toe assessment. It should take about 20 to 25 minutes. But do you need anything to drink or do you need to use the restroom? Okay, perfect. So I'm just going to raise the bed. And then do you know where you are at today?
Good Sam.
And do you know what year it is?
2020, unfortunately.
And do you know what day of the week it is?
Thursday.
Alright, so the patient is alert and oriented ×3. Alright, so first off I'm going to start with taking your vitals, which I passed the vital competency, so yay.
Yeah,
Alright, so I'm just going to be looking at your head. There's no bumps or lumps. Hair is thick, blonde, and evenly distributed. Alright. And then skin color is true to ethnicity, and the temperature is warm to touch. So I do notice a nose piercing, and I'm going to be checking your mucous membranes.
Thank you.
Alright, so mucous membranes are pink, moist, and intact. So we're going to be doing Perla, checking for your eyes, make sure they accommodate. So just look up a little bit for me, please. Thank you. Now just follow my pen light, please. Making sure consensual. Your pupils are about 3 millimeters, and they are round and reactive to light. Alright. And then I'm going to check temporal pulses. Alright. 2+ strength bilaterally and regular rhythm. Now I'm going to move to carotid. 2+ rhythm bilaterally, regular rhythm. Alright, now I'm going to check your brachial. 2+ strength, regular rhythm bilaterally, and then your radial pulses. Alright, and then that is also 2+ strength, bilaterally, regular rhythm. So I'm also going to be looking for edema, swelling. Looks like no edema is present, and then skin turgor. Looks like you're all hydrated, no skin turgor is present, and then your cap refill. So her nails are painted, so I will be touching her skin just above the nail. And then cap refill is brisk. Alright, so now I'm going to move down to your chest assessment. And do you mind taking off your shirt for me, please? Alright, so for her chest assessment, anteriorly, I will be checking apices, which are vesicular sounds. And vesicular sounds, inspiration is greater than expiration. I'll be checking or listening to her trachea, which are bronchial sounds, and expiration is greater than inspiration. And then I'll be moving down to the second intercostal space, which is bronchovesicular, and bronchovesicular is when inspiration and expiration are equal. And then 4th, 6th, and 8th intercostal spaces. So I just want you to breathe deeply, but I'm also want to say that she is breathing effortlessly. Do you mind lifting up just a little bit, please? Got it right on the spot.
Good to you.
Okay, and then 8. Okay. Lung sounds are clear to osculation anteriorly. Alright, Alex, and then I'm just going to have you sit up for me, please. And now posteriorly, I'll also be listening to the apices, which are vesicular sounds. I'll be listening to T3 and T4, which are bronchovesicular sounds. And then T6, T8, and T10, which are vesicular sounds as well. But for T8, that will be on the mid-scapular line, and T10 will be on the posterior axillary line. Alright, perfect. Alright, and then if you can just take deep breaths again for me, please. And then also my landmark will be C7. Alright, perfect. So lung sounds are clear to osculation posteriorly. Alright, you can go ahead and put your shirt back on and then just lift up a little above your sports bra, and I will be checking your abdomen. Oh. So I will be doing inspection. I did forget to mention that her chest is a 2-to-1 ratio. And then for her abdomen, it is symmetrical, it's flat. There is a belly button piercing. And then, are you having any pain or discomfort today? Alright, so I will be listening for bowel sounds on the diaphragm side. And I'll be starting in the right lower quadrant. Alright, bowel sounds are present and active. Now I'm going to be listening to your arteries. It will be iliac, aorta, femoral, and renal. And that will be on the bell side. And now I will be listening for bruits in all 4 quadrants. Bruits are swishing sounds, but I do not want to be hearing those. and this is also on the bell side. Perfect. So no brewy sounds were present. Now I'm going to be doing some light palpation. If you feel any pain at all, just let me know. Alright, great. So now, Alex, if you want to sit up and pull your shirt down, and we're going to be doing your lower extremities. Alright, so for this, it's the same. Color true to ethnicity, temperature warm to touch. Now I'll be checking your pulses, the popliteal, the posterior tibial, and then dorsalis pedis. Alright, so if you want to bend your legs up. Alright, so the popliteal is about 1+, which is a little diminished, but it's okay because we will be checking your other two pulses. Alright, 2+ bilaterally in regular rhythm. 2+ bilaterally, regular rhythm. Alright, so checking for edema, there's no swelling, so no edema is present. Cap refill on her feet. Her toes are painted, so again, I will be just hitting the tops of her toes, and her cap refill is brisk. We're going to be checking sensation. Do you mind closing your eyes for me, please?
Mm-hmm.
Alright, I'm going to put this tissue on your extremities, and then you just have to tell me where they are located for me, please.
Left thigh.
Thank you.
Right chin. Right arm. Left arm.
Alright, sensation is present. Alright, so I'm just going to walk over to the other side, and I need you to dangle your feet for me, please.
See my legs, I'm dangling.
Okay, just so you can scoot back a little bit. So hypothetically, her legs would be dangling. Right now I'm going to be checking for strength, so can you just push your legs against my feet? It's kind of hard. And then push them forward. Okay, and then push them down. Push them up. Alright, and then shoulders up. And then turn your face to the... Sorry. Turn your face to... 5 out of 5. Strength. Alright. I cannot take you. Alright, so then before I watch your gait, when you get ready during the day, do you have to take any breaks in between or anything like that?
Nope.
Alright, so that means good endurance. And then I'm going to be just flex your arm for me. And then muscle tone is good, present. Alright, so we're just going to try this. Okay, stand up for me, please. And then just walk forward for me. And then you can turn around and walk back. So her head is leading. Her arms are moving freely. Oh yeah, you can tell. My bad. And then all right. So we're gonna do a little bit of range of joint motion. I don't even know if you can.
Get on this. Like, right
What?
here.
Okay. Flexion, extension, hyperextension, and then rotation.
Mm.
And then for arms, flexion, extension, abduction, adduction, fingers, abduction, adduction, opposition. And then for the thumb, it would just be, yeah. Abduction? Yeah, and then adduction. I love you. Okay. And then pronation, supination. Then for your legs. Just a little bit. She loves us, it's fine. Shenanigans. Alright. Yeah. Flexion, extension. Abduction, adduction, flexion, extension, circumduction. And then for your ankles, inversion and eversion. And then for your toes, you can do abduction, adduction. Okay. Go ahead and sit down, please. Oh, back we go over here. Alright, perfect. So I'm just going to go ahead and look at everything, make sure I did not forget anything. Alright. Posture is erect. For your alignment, there's no abnormality, so there's no scoliosis, lordosis, or kyphosis noted. The room seems pretty clear right now, no clutter, no IVs or tubes. And I believe that is it. So before I end and lower your bed, is there anything I can get you? Or is everything good?
Nope, I'm good.
Alright, call light in reach, open privacy curtain, wash my hands, and there you go.